Hello, this is Dr. Jones. I'm going to show you an example of a massive cuff tear. So this is a patient that has a tear of basically the entire cuff, including the cuff in the front and the back of the shoulder. You can see we're looking down into the joint, and that's the edge of the tendon right there. So first step, once we get in, we want to kind of evaluate how mobile this tear is. So I come in and throw a suture through the tendon, and that gives us control of the tendon and allows us to assess how mobile it is. And what I mean by that is, will it pull over to the attachment site on the humerus? So once I do get it mobilized, I come in and I basically just remove all the tissue off the tuberosity, which is where the rotator cuff attaches. And then I take this little 2mm awl and punch a bunch of little holes in the bone. What I'm doing is I'm allowing some of the bone marrow elements to seep out into the area of the repair. And this has been shown to improve healing. So once we're all prepared, we start putting our anchors in. Typically, I place my anchors from front to back. The anchors serve as an anchor point for the sutures that we use to actually repair the cuff. So we retrieve the sutures individually, and we use this, we call this an antegrade suture passer to pass the sutures. These instruments that we have these days make this a lot easier. Once we get all the sutures passed, then we go and we start tying the sutures. Again, this is done arthroscopically. You can see I have very nice apposition of the tissue down to the bone. You want the sutures to be taut but not too tight, so you just want to see that it will slightly pinch the tissue. That tells us that we have loop security. So once I'm done, then I basically take the arm out of the holder and I move it around, make sure that everything is stable. So here I am going way down into the front of the shoulder, and this is the subscapularis repair that was done earlier. So this was a repair of a supraspinatus, infraspinatus, as well as the subscapularis. Thanks. Have a great day. Please feel free to email me if you have any questions.